I'm Judi Bosworth, Supervisor of the town of North Hempstead. As a mother and grandmother, I realize the immense challenges we face when it comes to keeping our children healthy and safe. If you have a teenager or young adult in your life, you know how vulnerable they are to a host of dangers ranging from internet predators to risky behaviors to safety to substance abuse. Communication is the key in letting them know that they do not face these challenges alone. Alcohol is the drug of choice among adolescents. We know it contributes to a wide range of health and social problems for our families. Underage drinking has severe consequences, many of which parents may not be fully aware of. Consequences may include injury or death from accidents, unintended, unwanted, and unprotected sexual activity, drug use, and academic problems. In 2013, over 1,000 Nassau County tweens, teens, and young adults were treated and released from a New York State emergency room for alcohol-related issues. We know that 1 in 3 teen drivers has driven after using alcohol. 1 in 5 teens has ridden with a driver who has been drinking, and every day, 1 in 5 teen drivers involved in a fatal crash has alcohol in his or her system. But research shows there is no greater influence on a young person's decision to drink alcohol than his or her own parents, guardians, or caregivers. The town of North Hempstead is proud to work with the Manhasset Community Coalition Against Substance Abuse in its efforts to reduce underage drinking among youth by connecting parents, schools, and the community as partners in this common goal. We hope you take away some important lessons from CASA's Prevention Through Connection show on North Hempstead Television, as CASA seeks to help viewers understand why underage drinking is prevalent in our communities, and more importantly, understand what we can do to help change that. And now, Manhasset CASA's Prevention Through Connection.
Welcome to Prevention Through Connection. I'm Cathy Samuels, Project Director for the Manhasset Community Coalition Against Substance Abuse, also known as CASA. Today's guest is Robert Teresa, Ph.D., Professor of Biobehavioral Health at Penn State University and faculty member in the Penn State University Prevention Research Center. Dr. Teresa is a leading expert on the role parent-adolescent relationships play in the prevention of underage drinking, and he is committed to reducing risk behaviors in adolescents, teens, and college students. He has been featured on NBC's Dateline, co-authored several books, and received numerous awards for his work in prevention science. His high school level parenting intervention is the centerpiece for Mothers Against Drunk Driving's MAD, Power of Parents Handbook. Welcome, Dr. Teresa.
Thank you for having me.
With alcohol use so prevalent in our country, many parents, they actually wonder if, in fact, underage drinking is a problem at all. What do you have to say to people who think, well, I've done it, I'm okay?
Well, I think that there are a lot of kids that do go through this experimental phase where they try a little alcohol and then things don't necessarily go bad for them. But the number of kids where the problems occur are substantial. So, for example, we could start with the number of deaths each year. Each year for young kids around 18 to 20 years old, there's about 1,400 deaths, and that translates into about 50 to 60 per weekend. So there's 50 to 60 children that have great futures, that are doing wonderful things with their lives, who aren't going to make it through a weekend where they're supposed to be having fun in social situations. And then there's another 500,000 kids who will end up in emergency room settings for either to alcohol poisonings or harm. And those that 500,000 is larger than the population of major cities like Boston and Miami and so on. So imagine every person in the city of Miami or Boston ending up in the emergency room that's the equivalent of what we're seeing, just from the aspect of drinking. We're not talking about other effects on their school, their careers, their lives, and other aspects.
So the level of drinking, it obviously, if people are dying and winding up in the emergency room, describe for our audience exactly what that college or young adult drinking scene looks like today.
Well, a lot of young people don't drink to be social. I mean, well, they do and they don't. So they're not having a drink and then talking about politics or talking about jobs and so on and so forth. They're drinking to get high. They're drinking to either get buzzed or drunk, but they're drinking to that point.
And, again, I want to go back to what parents think, I did it, I'm okay. So we know the level of drinking is much different. They're binge drinking, having 5 to 6 drinks every 2 hours. Actually, University of Maryland at College Park just recently came out saying it's actually 10 to 12 drinks, that it's much higher than we actually thought. In terms of that level of drinking, where parents are actually even saying, well, I want my kids to learn how to drink in high school. What can we say to parents in that capacity where they truly believe that they are helping their kids assimilate to the college scene?
Yeah. Well, I'm going to go to the science to start with the answer to that question. And we don't know any studies that have been published in the United States or anywhere else for that matter that shows a health benefit of teaching kids to drink. So I'd like to be able to know that. I'd like to be able to talk to parents and say, if you're going to teach your kids how to drink, do it this way. So for example, we know how to teach kids math, we know how to teach kids about history, but we really don't have a curriculum that says, here's the responsible way of teaching your kids how to drink. In fact, oftentimes what we see is that kids who do drink, maybe a glass of wine at dinner or something like that around the holidays with their parents, the studies show that those kids are more likely to drink more frequently and heavier when they're outside the home, when their parents aren't around, than the kids that don't drink with their parents.
So it's almost the opposite of what parents are thinking.
At least that's what the science shows.
The science says.
And we've done many of those studies, and then I have colleagues around the country, and then I have colleagues over in Europe. And again, all of the studies, where no matter where it happens, really speak to the same outcomes, and that is that kids that are allowed to drink earlier at home under the supervision of their parents, those kids on average drink more frequently and heavier when they're not. And I think if you know about the way that kids process information and make decisions, it does make some sense, because kids are not miniature adults. Their brain works differently.
And you mentioned the brain. So what can you tell our audience in terms of brain development in terms of the kids, and what exactly alcohol is doing to their brain development?
Well, the brain's really complicated, but I'm going to oversimplify it. There's 2 parts of the brain that make a difference in the way we make choices. One part is sort of in the middle of the brain, and it has a lot to do with our emotions. And so a lot of that part of the brain is going to have an impact on emotional-based decision making, like what I want now and how I feel and those kind of things. And then there's the front part of the brain, which is much more rational, and that's the one that thinks about risks and so on.
And that would be the prefrontal cortex?
Exactly.
Right.
And so what you have is you have sort of these 2 areas that are working together. And there's some scientific data that say the development of that prefrontal cortex, where the rational decision making comes, doesn't really happen until early, if not mid-20s. It's not fully formed. And so you'll see young people doing things that are completely rational, that make sense, that plan, and so on. So it's not like it's not there. It's just that the centers between the I want and I feel and the I think I should do it this way, I shouldn't do it that way, they're not as strong as they could be, I guess. So as adults, we always look back and go, oh, if I could have done it differently. And that's the difference between the way our brain works and their brain works. So their view is, I think I can handle it. I think I can control it, but a lot of times the emotions of the situation or the context in which the drinking occurs is going to change. So for example, you don't oftentimes see adults doing the kind of fast drinking, slugging from bottles, those kind of things that younger people are likely to do. And it's alcohol in, alcohol out. So once that alcohol is in your body, you're going to be processing information differently. And every decision you make after that's going to be affected by the drug.
Right,
I mean,
so their
the
impulse control and their ability to make rational decisions normally are not necessarily fully developed as that of an adult.
Exactly.
So while you're under alcohol, you're making more riskier decisions and putting yourself maybe in more physical situations that could harm your body and others.
Yeah, and the context too. I mean, think about like if you're sitting at your dinner table and everybody's having a conversation and you have extended family there and somebody's sipping wine, you're setting sort of a standard for the pace at which people are drinking, how much is acceptable, how much isn't. Where now you take that to maybe a keg party in somebody's basement or in the field or something like that, where there really aren't the same set of rules about how fast you drink, what you drink, the way you drink it. So what we know is it's not only what you say, but the way you say it and the way you deliver it. And so there are different types of parents. So some parents are going to be like, I set the laws, I set the rules, this is what I say. And what they're doing is they're asking the kids to come to where they are. And some kids are going to do that. And some kids might not have the capacity. Their brain might not be yet wired to fully be able to follow all the rules all the time. That's just the way it works. And then some parents are going to go to the kid. And they're going to say, okay, where's the kid at? And they're going to go to the kid and try and find a halfway point. And they're going to work with the kid. That doesn't mean they're going to give in to everything the kid does. They're going to still be parents. They're going to still be the responsible adult. But at the same time, they're going to be invested in the outcome, and they're going to look to solutions that are sort of jointly made. And by doing that, you're also helping the child learn how to make these adult decisions. And in a way, you're exercising that child's brain so the child's brain's able to make that decision when the parents aren't around.
So parents really have to be up on understanding what's really going on whether it's college campuses or within their high schools, and they need to understand the manner in which they say things to their and model
and what they say. Communicate in a positive way, because I could say 10 really good things to my child and then say one bad thing, and the bad thing's going to resonate. So it's not just a load up on all the good, but try and also reduce the negative, the things where you're going to have the confrontation. That doesn't mean don't confront your kids. It just means try and adopt more positive practices to communication as opposed to having a negative style. And it's easy. It's easy to be sarcastic. It's easy to be, to say that's ridiculous, that's stupid, and so on. Because sometimes we look at it and go, that's ridiculous, that's stupid, and
right.
so on. But a positive communication practices, it teaches that, but it also models that. And so it's a combination of those two. So positive communication would be one. The other one would be monitoring, which is, as much as their children want independence, and we want them to have independence, we don't want to follow them around all the time. We do want to make sure that they're okay. So it's good to know where they're going, what they're going to be doing, when they're going to be back, who's going to be there, is there going to be anything around? Because these are real risks. They're not made up in our minds.
So monitoring, just, on any Friday night a child is getting a phone call to go for a sleepover at Johnny's house or Sally's house, parents should do what? They should call.
This sounds like babysitting, what I'm about to
right.
say. But really, what I think it depends again, on the maturity of the kid. But I think it's okay for you to say to your child, are the parents going to be out home that night? Right. And of course, what's your child going to say? Yes, of course they're going to be able to go. Okay, well then give me their cell number. I'm just going to, if you don't mind, so that we have it just in case. And then a nice strategy could be that the parent could call and say, look, is there anything I could do to help? Sometimes they'll go, no, we got it, everything's wonderful, fantastic. And other times, oh, really? They're going to have a sleepover?
Right,
this is news to me,
Right.
And so it's just something subtle like that. Like, is there anything I could do to be, assistance, that kind of thing.
So communicating, of course, is of utmost importance in the relationship we have with our child. And at this point, we want to take a quick break and hear from our friends at the Substance Abuse and Mental Health Services Administration about the importance of parents talking early with their children about the dangers of alcohol.
Can I go to the sleepover?
I want you to promise me something. If there's any drinking, I want you to say, no thanks, not my thing.
I promise, Mom.
They really do hear you.
Did you pack your toothbrush?
For tips on how to start the talk, visit underagedrinking.samhsa.gov.
Kids start to experiment with alcohol as early as 9 years old. It's never too early to talk to your child about the dangers of underage drinking. Your kids really do hear you. Do you know what to say? For tips, visit underagedrinking.samhsa.gov.
Welcome back. We're talking with Dr. Robert Teresa from Penn State University's Prevention Resource Center, a leading expert on the role parent-adolescent relationships play in the prevention of underage drinking. Dr. Teresa, we were just talking about communication and the importance of communication, and I know you have a parent-based intervention that you've done with Mothers Against Drunk Driving's Power of Parenting Handbook. Can you tell us a little bit about that resource and what it means for parents?
Sure. When we first started trying to make a difference with parents, we wanted to be able to compare things that parents did that did a really good job of helping their kids through these times versus the ones that didn't. So a lot of what I'm going to talk about comes to studies of those comparisons between families that have kids that go through this process and they just do really well against parents who go through this process and have all kinds of difficulties. And you see the outcomes with their children. So everything that I'm going to talk about is really about doing these studies that compare the different types of families. And what these materials do is they highlight the things that parents the content that they could use that directly impacts the way young people make decisions about how much to drink, when to drink, who to drink with, why to drink, why not to drink, ways to protect themselves if they drink, protective behaviors.
It sounds like they're addressing some really tough questions for parents as they're raising adolescents.
Absolutely, and there's different versions for adolescents than there are for college students because of the different level of maturity and the different social situations that they're in.
You know, in Nassau County, we have a social host law, and you know, a lot of parents, again, I'm going to go back to the beginning of our discussion, parents actually think they're doing their kids a favor by teaching them, quote unquote, how to drink at home. So we have a social host law, and we know the science and the brain research, but many parents turn and look to Europe, and they say, well, the drinking age in Europe is 16. What can you tell our audience with regards to that, so that parents, again, can have a better understanding of why the Power of Parents Handbook is out there, helping them to talk with their kids about the dangers of underage drinking?
Let me start with Europe, but also Canada, because Canada has a younger drinking age than the US as well. The data are really interesting because initially most of us believed that in Europe, where there's a lot more modeling and there's a lot more family transmission of the values of alcohol, that Europe was the model by which we should look at and go, oh, they have a younger drinking age and they teach their kids how to drink responsible and they don't have any problems. Well, actually it turns out that the science doesn't back that up. I saw a graph that was presented by Ralph Hinkson, who's the Associate Director of the National Institute on Alcohol Abuse and Alcoholism for the US. And he had the amount of times that a 13 to 15-year-old is drunk. And he had every single country in Europe, and then he had the United States. And the United States was lower than almost every single country except for countries where there was strong religious values that kept young people and adults from drinking. So the US was well below those kids in terms of number of times drunk on a weekend. And this is not like having a couple of sips. These are 13 to 15-year-olds getting drunk from drinking alcohol outside the supervision of their parents. So the view that Europe has it all figured out and that we should look to them for a younger drinking age, it's not backed up at all. And then the second slide that I saw was the lifetime alcohol problems, and that the earlier that people start to drink, the higher the likelihood is that they're going to have lifelong alcohol problems.
And that's dependency we're talking about.
Dependency, treatment, brain function, education, aspirations, jobs. You go right down the list. In fact, there's no data that actually shows that the earlier that you start drinking, the better your life is. There just simply isn't. We have to realize that alcohol is a drug, like many of the other drugs, and it's a controlled substance. And the way that we control it is we limit the control until people reach the age at which they're supposed to make mature decisions. The reality of young people never having a drink until they're 21 is not supported by any of the national studies. Most people try alcohol well before they're 21. However, we do know from all these same studies that are going on, again, these are really well done studies, that show that the later that young people drink, the more they're going to be drinking less frequently, and having less problems with it. And again, thinking about any drug that we would use, we want to use any drug less frequently and not have problems. And alcohol is just one of those drugs. It's a controlled substance. So in the US, actually, despite the fact that a lot of parents feel the pressure to let their kids drink in some capacity before they're 21, we have the lowest rates of problems by comparison to other places.
Right,
and yet,
right.
if we look in the media and we look in our emergency rooms and we do have problems. So the reality is we do have, it is the number one health-related problem for people between the ages of 17 and 25. These are really, really, really healthy people other than the exposure to this drug. And I don't want to sit here, it's really important for your audience to realize I'm not sitting here saying, oh, for adults, abstinence is it isn't. It's a wonderful drug. We toast people during weddings,
Of course.
at that level.
Yes.
It has a lot of benefits. People go to France, they drink they drink wine. It has its benefits.
I mean,
for that.
we know, whether it's any person drinking responsible and showing responsible behaviors and role modeling, responsibility is important aspect of parenting. So the science tells us that Europe has its problems. We know 21 saves lives. And I'm going to go back again to tools parents can use. This Nassau County Social Host Law is designed to give parents, again, another reason why kids should not be underage drinking in homes. And last, I want to go back to your parenting tools and the communication aspects of your research. Again, what can parents do to relay the importance and the dangers of underage drinking?
Yeah, well, I hate to oversimplify this, but the one thing that we keep on seeing that's got the strongest relationship with the problems that young people have is their parents allowing them to have access to alcohol at an earlier age. And when I say earlier age, 13, 14, 15, 16, 17,
Right.
18.
Right.
I mean, it really does make a difference. In fact, we've done these studies where we've looked at when young people drink in high school in their senior year, and then we look at their substance use in college or after they graduate, and it's substantially higher. And not only is it higher, those are the kids that are more likely to get in trouble. We have this one group that we call the MRC Group, and MRC is just an acronym for multiple repeated consequences. So when we see people post-high school, there's one group of kids who they get in trouble and they have problems like they black out, they pass out, they overdose, just whatever the problems are, they have more of those, okay? And then there's another group that has the same problems, but they have them frequently. So they have regular blacking out. And
Can you define what a blackout is, just for the audience?
I was about to go back.
Yeah.
The difference between blacking out and passing out is when you become completely unconscious. And blacking out is when you're completely alert and awake, and I'm having a conversation with you, but my brain is no longer forming memories. The brain has decided memories are not important. Breathing and heart rate is, and so it shuts off this concept of remembering anything about what's happening. And blackouts actually happen at much lower blood alcohol concentrations than passing out. But it's a symptom, it's a message that your brain is now responding to the fact that you have too much of a poison in your body, and so it's shutting down the rational part, the frontal cortex.
So of the kids who are, so again, back to your research, of the kids who are seniors who are drinking in high school and then go off to college, they're fitting in two of these categories.
Well, actually, they fit in a third category.
Oh, okay,
and
go ahead.
The third category are multiple consequences, but repeatedly. And they make up what we call like, it's like a 20-50 ratio, if you will. They make up 20% of the kids who drink, but they account for half of all the problems that happen for those young people.
So what kind of consequences are going on college campuses today?
Well, I want to point out too that whatever's happening on college at that age level, it's also happening at that age level that's not on college. So I want to make that real clear from the beginning. So the kind of consequences that we see frequently, we do see a lot of blacking out. So kids drink to the level at which they no longer are processing information that they're going to store. Now some people would say, well, that's not such a big deal, but the other symptom of that is that not only do you not remember anything at the time that you're doing it, but you're actually doing all these things. So you could not remember deciding to get in your car and drive, but you get in your car and drive. You cannot remember getting into a fight with someone, but you can get into a fight with someone. You cannot remember calling somebody a name, but you're calling somebody or reacting something.
Right.
So blacking out's one of them. The other one is obviously passing out. So getting to the point where you're so sick that you pass out. And often
this,
with that comes, and I hate to say this because it's public television, but vomiting. And vomiting is a response again for your body.
For
it's
alcohol
not,
poisoning.
It's not like I can't hold my alcohol. It's where your body is trying to get rid of the poison. And
Right.
when people aspirate, and then it could go in their lungs, and they could choke on it, and they could die. I mean, and that's what we see. But they could also fall. We see kids that fall out of buildings. We see kids that think that there's stairs and that they don't realize and they don't negotiate it, and then they walk off of things, or they walk down things, or they walk into traffic. And so these are the kinds of things that end up having kids show up in emergency rooms.
And with that, so whether it's college campuses or high school campuses and homes, we're seeing injury, we're seeing physical assault, we're seeing death, and such an importance for parents to continue to talk with their kids about the dangers of alcohol.
And the kids who are drinking in high school are more likely to be in that group. That MRC, the 20, 50. They make up 1 out of 5 kids who drink, but they account for half of all the problems. That means that the other 80% of the kids are drinking at a level that they're making up the other half of the problem. So those kids who drink earlier are much, much higher. In fact, that's the target group that we're really looking to reach. And it's interesting because we've looked at predictors, parenting predictors of that group, and the number one parenting predictor is where parents go, well, I think they can handle a couple of drinks. They're old enough, they're mature enough.
Dr. Turrisi,
That's it.
That's quite a fact, and thank you so much for being with us here today and relaying all this important information on how we can keep our kids safe, both at home as well as on college campuses. In closing, alcohol is widely used by both adults and children and is prevalent in our society. In Nassau County, the average age of youth first using alcohol is 13. And of the youth who report alcohol use, 39% of 11th and 12th grade students and 19% of 9th and 10th grade students are binge drinking, or having 5 or more drinks of alcohol in a row in the past 2 weeks. When teens binge drink, they put themselves in unhealthy situations that are dangerous to their physical, social, and emotional well-being. In 2013, over 1,000 Nassau County tweens, teens, and young adults were treated and released from a New York State emergency room for alcohol-related issues. We hope today's program has been helpful in guiding parents and caregivers toward understanding the importance of communicating the dangers of underage drinking with their children. As Dr. Turrisi notes, parents do make a difference, and despite how you may feel sometimes, research shows that parents are the most important influence on whether or not a teen chooses to drink alcohol or engage in risk behaviors. For additional resources about communicating with your child, go to our website at manhassetcasa.org or like us on Facebook. Until next time, this is Cathy Samuels, Project Director with Manhasset CASA, wishing you and your family a healthy and safe tomorrow. Thank you.